Welcome back to Boomer Health at Home. I'm your acting host today, Greg Jamian. Our normal host of this show is Brett Pulte, and he is out having a baby today. So he's got a great excuse, and we wish him the best of luck. But today we're going to be talking about the truth about no fault and seniors relating to Medicare. And we have a guest with us that's no stranger to Bloomfield Television or the community, John Jamian. How are you, John?
I'm doing great. Thank you, Greg.
John, we always start by telling viewers a little bit about yourself. No campaign speeches. I know you're not running for anything now. I can attest for that. But for the viewers that don't know you, why don't you tell us a little bit about yourself and where you grew up?
Well, I grew up in Birmingham. I went to Birmingham Groves High School, and then later on got married, and then I ended up moving to Bloomfield Township. I lived off of Corton and Telegraph for many, many years, and I was a resident of this community. And it was always was in healthcare, loved healthcare, but I had a real passion for politics, and it was kind of a secret desire of mine. And when the opportunity came up, I decided to run for my first elective office and for state representative. I won my first campaign, my second campaign, and my third campaign, and it was a real honor to be able to serve our community. So it was a lot of fun. It was a real honor, and it was an interesting time during the 90s working with Governor Engler and getting a lot of things done.
Now, did you work on any committees, important committees when you were up there?
As a matter of fact, unlike today's environment with term limits, I was very, very fortunate to become the chairman of the Public Health Committee, the House of Representatives Public Health Committee, my second term. And the reason for that was that the Speaker, Paul Hilligans, knew of my healthcare background, knew I was educated in healthcare, and even though there was a long wait to become a chairman, he decided to move me up because there's a lot of important things we did for healthcare reform.
Wow, okay. And you left politics, or not quite, but you stepped down from the state. And what did you do after that? Did you have any appointed positions? Did you hold any appointed positions?
I had a few, actually. I was very fortunate. Governor Engler, when I left politics, decided to retire on my own from the House of Representatives. Governor Engler made a phone call to me, and he asked if I would be willing to go down and run the Port of Detroit, the Detroit-Wayne County Port Authority. There were some financial issues that he was concerned about, and so he appointed me to that position. I ran the Port Authority, and then after that, I was again very fortunate, Greg, that I received a call from the White House, and I was asked to go interview for a position working for President George W. Bush at the time. And I drove to Washington, did an interview, turned around and drove back. I was hired 3 months later after thorough background checks, which is kind of a funny story.
They never called me, though.
Yeah, that's really interesting. They went to my neighbors, and I had just moved into my community at Wabeek, and my neighbors hardly knew me, and the FBI showed up at their door and said, "Hey, do you know this guy?" And they said, "Well, you know, what's the matter with him?" But they did interview a lot of people. I went through all kinds of security clearances and background checks and things like that. And in May of 2003, I ended up living in Washington and working for the president. And I was running the U.S. maritime industry. So it was really, really a fascinating time. We were going to war with Iraq and Afghanistan. I was in charge of all the sea lift, which means taking all the provisions to go to war, not the troops, but all the supplies. And really a lot of medical supplies too. So that kind of fit in with my background.
And you also worked on a hurricane, didn't you?
So everyone knows famous Hurricane Katrina that devastated New Orleans and also Beaumont, Texas. And I was the second operation, my group was the second operation into that devastated Ward 9 down in New Orleans. The Coast Guard were first, the U.S. Maritime Administration was second. I went down and saw the powerful destruction that hurricane caused, and the misery and the deaths that it caused for many, many people, families.
So you decided to get out of politics and go back to work and hold an honest job, right? Where do you currently work?
So I currently work at Sun Medical Equipment and Supply in Troy, Michigan. We have 2 stores, one in Romeo, Michigan, and one at St. Joe's Hospital right around the corner from here on Woodward Avenue. And I also run RxIV Pharmacy, which is also very interesting because we take care of a lot of seniors. We deal with a lot of insurances, and we provide medical supplies and we supply pharmaceutical products to help people at home.
I see. So, today's topic actually is the truth about no fault and how it impacts, seniors in Michigan specifically. Can you explain to us in general terms, easy for us to understand, what's the back and forth on this no fault issue? Is there we could probably talk about it for hours, but basically, what do our viewers need to know?
Well, I want to preface my comment by saying that I was also the vice chairman of the insurance committee in the House of Representatives, so I learned a lot about insurance companies and how they operate and what their motives are. No fault is an issue. No fault insurance reform is an issue that's been on deck for, probably 10, 12 years at least. And everybody wants to have reduced insurance premiums, Greg, but the truth behind it is, in all these packages that have gone on in many legislative sessions over the years, the voters and the members of the House and Senate have spoken loudly saying we do not want reform unless we have the continued lifetime care benefits. It's a real great benefit that we have in Michigan. But we also need reductions in premiums. And the reason why it's never passed true no-fault reform is because the insurance industry has never guaranteed a reduction in your premium. And they won't.
Okay. But do other states have a program like we have here in Michigan?
The closest state that has a program like our program in Michigan is Florida. And it's kind of similar, but it's not as good as our program here. We have the best auto insurance in the nation. And there are a lot of reasons why people see increased premiums. And a lot of people say we're the most expensive in the nation. That's an absolute lie. That's not true at all. Yes, we're higher. New York's higher. Many other states. California's higher. So we have a great benefit with unlimited lifetime health care should you get in a devastating accident. Your health insurance portion of your no-fault car insurance will take care of you the rest of your life.
It sounds like a good thing to me, and we're going to get into it in a minute, at not much of a cost. I like that.
Right.
So who's behind this movement to take away a tremendous benefit from Michiganders and now this new thing we're going to talk about, seniors?
So, Greg, the misnomer is that you're going to see this reduction in premiums. That's not going to happen. The people behind this, it's the insurance industry. It's really a money grab. When was the last time, Greg, your insurance company called you or sent you a notice saying, hey, just for the fun of it, we're going to reduce your premiums?
Well, we have Blue Cross and, and AAA, and it seems like the rates just keep going up every year. So
yeah, they don't go down, do they?
Yeah, no.
So I think everyone would agree with me and us. The insurance industry is behind this because there's a lot of money in a fund called the Michigan Catastrophic Claims Fund that we as citizens all pay $180 a year. That's all you pay. And that money goes into this catastrophic claims fund, every driver. And this fund is designed to protect you with lifetime health care benefits should you get in an accident, whether it's your fault or not. And so that money, there's a lot of money there. Obviously, it's kind of like an annuity. And the insurance industry wants that money. What's interesting, Greg, we as citizens and auto driver insurers, we have paid into that fund for years and years and years. That's actually our money designed to protect us. And who's behind this legislative reform? It's the insurance industry, because they want that money. They're not going to give it back to us. They want to put their hands on it.
Yeah. So their claim is the spiraling cost of auto insurance is due to the medical piece that's in there that you just described. How much does that medical piece actually cost an average driver in the state of Michigan?
The cost of that medical piece is $180 a year on your car insurance premium. And the fact of the matter is, and no one talks about this, including the media, when they're describing this no-fault reform package that's been going on, your high cost of insurance is due to several factors. They have a rating system, 1 to 10, and that rating system gives you an insurance score based on your gender. If you're female, you pay more. If you're a widow, you pay like 200% more. If your credit's not that great, you pay more. If your job is not what they view as a very successful job, you pay more. If your education's not that great, you pay more. And then, on top of it, when everybody in the city of Detroit's complaining about how high the cost of their insurance is, which it is, it's not due to the medical piece of $180 a year, Greg. It's due because crime. We have the highest auto thefts in Detroit. It's due to neighborhoods. It's due to all the other factors in the insurance score I talked about. That's what they're not in collision.
So it's a smoke screen.
Yes.
They're using it as a smoke screen. Well, yeah, they've guaranteed, the insurance companies have guaranteed the claim that if we can, eliminate, no fault or seriously reduce it, that's going to drive premiums down. But that's just a claim, because I know many legislators have pushed insurance companies to come on the record and say, for every dollar we save, we're going to pass that through to the consumer. But you're saying that simply isn't true.
That is absolutely not true. One of the amazing facts about this whole thing is that the insurance industry, when they're really, really pressed, they might say, they have in the past, not in any written statements, that maybe we'll give you 40% of the PIP portion, of personal injury protection portion of your policy. Remember, it's $180 a year. So they're claiming the savings you're going to get with this no-fault reform is 40% of the 180.
So, John, what are some of the benefits that this no-fault affords people? It's mandatory you have to have insurance in the state of Michigan. So if you do get in an auto accident, auto accidents are nasty. They really hurt and bang people up.
Right.
We've seen it in our business, okay? And some of these people are damaged, hate to use that word, but for the rest of their life. So what kinds of services are covered for these people? And it can happen to anybody at any time. In fact, I'd like to say Oakland County roads are some of the safest in the United States, and we have statistics that show that. And the overall safety record for motorists is coming down nationwide. But what are some of the services or benefits that are covered under auto no fault?
So,
if I get injured in an auto accident.
Right. We don't leave our house in the morning saying, today I'm going to get in an accident. And I like to think that everyone drives much safer today too, especially with the technology in automobiles. But the benefits, when you go from a minor accident to a catastrophic accident, whether it's your fault or not, what happens is after you're in the hospital and hopefully they've fixed you up, you might require care for a month. You might require care for a year, decades, the rest of your life. And those benefits could be an attendant care, which is like a home health aide that would stay with you and help you with all the things you need help. Think of Christopher Reeves. There are many people in auto accidents like him. And then it will give you a nurse if you need a nurse 24/7. If you need a nurse just 8 hours a day. It'll give you physical therapy for as long as you need it. It'll give you occupational therapy for as long as you need it. It'll provide modifications for your home. At Sun Medical, what we do is people need all kinds of adaptive equipment in their home, including shower bars, bath benches.
Well, I know Medicare doesn't pay for that stuff.
That's right.
And so, seniors, and let's face it, there's a lot of seniors that are involved in auto accidents, and a lot of, they're victims, and sometimes, I hate to say it, they're the cause too, but for the most part, seniors are fairly careful drivers. But, home modifications, so now you're injured and you live in this nice house in Royal Oak or Bloomfield or Birmingham, and you can't walk up the stairs anymore. So under Medicare or Blue Cross, I mean, those things wouldn't be covered, but under your auto no fault, it would provide maybe for a person, attendant care, to help you up those stairs. Or if that's not available, stair glide, stair lift.
Yes.
Or modify a room on your lower level to accommodate you, your showering and sleeping and that sort of thing. So those are benefits that are really valuable benefits that these auto insurance want to take away now. This is unbelievable. It's like, seems like every time you look, someone's moving your cheese.
Right. It's really about the money for the insurance industry. And what happens also is that if you're a senior citizen, everybody thinks that Medicare or your health insurance will pay for everything related to your health care. It's not true at all.
Okay, so I want to talk about that because that's really kind of the purpose of the show that we wanted to cover. And that is, there's legislation pending right now, and you probably know more about it than I do, that says Mr. Boomer or Mr. Senior Citizen, when you go to apply for auto insurance for your car, we're going to automatically assume you're opting out of the no fault, the medical benefit piece. Is that good? Is that a smart thing? And by the way, you're really not going to save any money, but you can opt out of it and give your. So we're going to just assume that the default position when you apply for insurance is that you don't want no fault. And if you don't ask, we're not going to tell you.
Right.
What kind of game is that?
Well, that's a great point. And people really need to understand that the default is you automatically opt out. You're a senior citizen, Greg, and guess what? Your Medicare will pay for it. Absolutely not true.
Okay, so that's a lie. So they're saying, it's redundant coverage. You don't need it because you got Medicare. But Medicare does not cover the items that we just listed previously. And those are all valuable things that can sustain your life. What happens if you don't have those coverages?
Can you imagine the disaster? You've already been through a catastrophic accident. Your life has been torn upside down. You might have, you can't work anymore. You need adaptive equipment. You need home modifications, and all that goes into trying to recover your life as best as possible. And they want to take it away. Remember, for that $180 a year in your auto insurance premium, you're getting lifetime benefits and protection.
Okay, so under Medicare doesn't pay for a nursing home for the rest of your life.
No.
You have to qualify under Medicaid. What's that all about? So now I'm depleting my savings that I've worked really hard to retire on.
Right.
To just barely sustain my style of living. And now I'm depleting that to cover my nursing home at $200, $300 a day. Won't take long to go through a nice little nest egg. So that's what the insurance companies are asking you to do, versus the current program, which we have in place now, under the no fault. That coverage for that nursing home or that rehab care center would come out of the auto insurance fund. which makes much more sense to me.
It's worked, Greg. For 30 years, it's worked, and you'll end up. You asked the question about what would happen if they took that lifetime benefit away, which they want to do.
Bankruptcy.
Bankruptcy. And you know what? Who wants to end up in a Medicaid nursing home the rest of your life? Your family's not going to be able to afford that care. That's why we have insurance, Greg. And it's going to bankrupt families. It's a horrible thing.
So basically your message is let's leave it alone. And we don't need to tinker with it. And the insurance companies and the lobbyists need to stay out of trying to change the existing laws in the state of Michigan, which, by the way, are a great example for the rest of the country. And by the way, our veterans that are coming back from Iraq and everywhere else with head injuries and spinal cord injuries benefit from this state having one of the finest rehab groups of providers in maybe the world. Is that a fair statement?
It's 100% true.
Okay, so we're approaching a lame duck, and this kind of stuff gets really, really tricky around lame duck. Explain to us what a lame duck is and what we're going into right now. And this is a natural occurrence in government. It happens often, but tell us what lame duck is.
Lame duck is something that everybody should pay attention to and watch very closely. As a former state representative, I will give you a great example of what happens in lame duck. When a group of lawmakers, whether it's the Speaker of the House, the Senate Majority Leader, the Governor, if they want some laws passed and they know the public does not support those laws and they want to slip it through really quick, sometimes under the cover of midnight, they go into lame duck. Lame duck is that period when, after elections, the legislature comes back into session, usually around this time of year, and they have a legislative session from mid-November to about December 18th. In that small period of time, it's quite often referred to as lame duck because, that's when you can foist a lot of bad legislation that people really don't want and do it quickly.
And you're not accountable.
And you're not accountable.
Because you're not going back to the office.
It's the lobbyist's dream. It's the insurance industry's dream. And so what's dangerous about lame duck is that they'll push for certain things like this really bad no-fault package. And
which has been approved, which has been referendum by the people twice, right?
That's correct. The voters have spoken out twice saying, we do not want this kind of reform. The lawmakers have voted, like I said, 10, 15 years on this. We do not want this reform.
You had a story about John Engler and lame duck.
So I will give you a great example. In lame duck, when we wanted to do some tax reform, at that time, we were a very, very close house in terms of both parties had an equal number of representation or representatives. So the Democrats had 55, the Republicans had 55 members. It was difficult unless you really worked in a bipartisan fashion to get something done. Well, Governor Engler really wanted tax reform done, and the kind of tax reform he wanted done, the Democrats did not want that kind of tax reform. But the governor knew that this was really important to stimulate the economy and to help people with their income and their taxes on their houses. So under lame duck, he held us in the House of Representatives. You can actually lock the members of the House and Senate in the chamber, and the sergeant of arms guard the doors. You are absolutely not allowed to leave. And they locked us in for 36 straight hours, Greg, December 22nd. Now, every lawmaker wants to go home to their family for Christmas, right? We also want to, for Greg's birthday, I hear it's December 24th. Yeah. So, everybody's really anxious to go home. That's the time when you can get anything passed. And what they do, Greg, is they put a stack of bills on your desk this high, and they expect you to read it in 5 minutes. Well, that's not going to happen. And so that's when they start putting muscle on you. The lobbyists start calling you on your floor phone. The governor's people come in and they say, this is what we want. And they break you down. And believe me, after you've been up for 24 straight hours and eating nothing but junk food because there's no cafeteria inside the house, you're about ready to cave in on anything.
That's amazing. I never really knew that, and I'm sure many of us, many of our viewers never knew that either. Thanks for sharing that story with us.
So that's what's going to happen, Greg, when they try to do no-fault reform again. They're going to try to do the same thing. And that's why it's important for everybody to make sure they contact their senator, their state senator, or their state representative. Contact them.
Maybe even write a letter or fax or something.
Absolutely. Really important.
Well, I want to thank you for coming in today and sharing that with us, because it affects, seniors, but it also affects all the motorists in the state of Michigan. And thank you, former Representative John Jamian. Do they still use the term representative?
When I'm in the Capitol, they do. There are a few people that still recognize me from many years ago. But one important point that I want to say is, don't be misled about Medicare covering the same benefits that your auto insurance does. It does not. If you need a lifetime of care and you do not want to be bankrupt or in a nursing home, Medicaid nursing home, that $180 is the best value you can possibly get to protect you.
Very good. And we'll end it there. Thank you for coming in. You've been watching Boomer Health at Home. I'm your host, Greg Jamian. Thank you very much, and have a great day.